NMCCBT questions and answers. Question number 401. You are looking after a post-operative patient, and when carrying out their observations, you discover that they are tachycardic and anxious, with an increased respiratory rate. What could be happening? What would you do? Option A. The patient is showing symptoms of hypovolemic shock. Investigate source of fluid loss, administer fluid replacement and get medical support. Option B. The patient is demonstrating symptoms of atelectasis. Administer a nebulizer, refer to physiotherapist for assessment. Option C. The patient is demonstrating symptoms of uncontrolled pain. Administer prescribed analgesia, seek assistance from medical team. Option D. The patient is demonstrating symptoms of hyperventilation. Offer reassurance, administer oxygen. The correct answer is option A. The patient is showing symptoms of hypovolemic shock. Investigate source of fluid loss, administer fluid replacement and get medical support. Question number 402. A patient has just returned to the unit from surgery. The nurse transferred him to his bed but did not put up the side rails. The patient fell and was injured. What kind of liability does the nurse have? Option A. None. Option B. Negligence. Option C. Intentional tort. Option D. Assault and battery. The correct answer is option B. Negligence. Question number 403. Which of the following is not a risk factor for ectopic pregnancy? Option A. Alcohol abuse. Option B. Smoking. Option C. Tubal or pelvic surgery. Option D. Previous ectopic pregnancy. The correct answer is option A. Alcohol abuse. Question number 404. A new mother is admitted to the acute psychiatric unit with severe postpartum depression. She is tearful and states, "I don't know why this happened to me. I was so excited for my baby to come, but now I don't know which of the following responses by the nurse is most therapeutic." Option A. Maybe you weren't ready for a child after all. Option B. Having a new baby is stressful, and the tiredness and different hormone levels don't help. It happens to many new mothers and is very treatable. Option C. What happened once you brought the baby home? Did you feel nervous? Option D. Has your husband been helping you with the housework at all? The correct answer is option B. Having a new baby is stressful, and the tiredness and different hormone levels don't help. It happens to many new mothers and is very treatable. Question number 405. After the physician performs an amniotomy, the nurse's first action should be to assess the option A. degree of cervical dilation. Option B. fetal heart tones. Option C. client's vital signs. Option D. client's level of discomfort. The correct answer is option B. fetal heart tones. Question number 406. A client telephones the emergency room stating that she thinks that she is in labor. The nurse should tell the client that labor has probably begun when. Option A. Her contractions are 2 minutes apart. Option B. She has back pain and a bloody discharge. Option C. She experiences abdominal pain and frequent urination. Option D. Her contractions are 5 minutes apart. The correct answer is option D. Her contractions are 5 minutes apart. Question number 407. The nurse is teaching a pregnant client about nutritional needs during pregnancy. Which menu selection will best meet the nutritional needs of the pregnant client? Option A. Hamburger patty, green beans, French fries, and iced tea. Option B. Roast beef sandwich, potato chips, baked beans, and cola. Option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Option D. Fish sandwich, gelatin with fruit, and coffee. The correct answer is option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Question number 408. The following are all nursing diagnoses appropriate for a gravida 1 para 0 in labor. Which one would be most appropriate for the prima gravida as she completes the early phase of labor? Option A, impaired gas exchange related to hyperventilation. Option B, alteration in placental perfusion related to maternal position. Option C, impaired physical mobility related to fetal monitoring equipment. Option D, potential fluid volume deficit related to decreased fluid intake. The correct answer is option D, potential fluid volume deficit related to decreased fluid intake. Question number 409. A vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions at this time? Option A, anticipate the need for a cesarean section. Option B, apply an internal fetal monitor. Option C, place the client in genupectoral position. Option D, perform an ultrasound. The correct answer is option B, apply an internal fetal monitor. Question number 410. Under the Carers, Equal Opportunities Act, 2004, what are carers entitled to? Option A, their own assessment. Option B, financial support. Option C, respite care. Option D, all of the above. The correct answer is option D, all of the above. Question number 411. The nurse is assessing the deep tendon reflexes of a client with preeclampsia. Which method is used to elicit the biceps reflex? Option A, the nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with the reflex hammer. Option B, the nurse loosely suspends the client's arm in an open hand while tapping the back of the client's elbow. Option C, the nurse instructs the client to dangle her legs as the nurse strikes the area below the patella with the blunt side of the reflex hammer. Option D, the nurse instructs the client to place her arms loosely at her side as the nurse strikes the muscle insert just above the wrist. The correct answer is option A, the nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with the reflex hammer. Question number 412. What law should be taken into consideration when a patient has hearing difficulties and would need hearing aids? Option A, Mental Capacity Act. Option B, Equality Act. Option C, Communication Law. The correct answer is option C, Communication Law. Question number 413. The nurse is measuring the duration of the client's contractions. Which statement is true regarding the measurement of the duration of contractions? Option A, duration is measured by timing from the beginning of one contraction to the beginning of the next contraction. Option B, duration is measured by timing from the end of one contraction to the beginning of the next contraction. Option C, duration is measured by timing from the beginning of one contraction to the end of the same contraction. Option D, duration is measured by timing from the peak of one contraction to the end of the same contraction. The correct answer is option C, duration is measured by timing from the beginning of one contraction to the end of the same contraction. Question number 414. A client with diabetes visits the prenatal clinic at 28 weeks gestation. Which statement is true regarding insulin needs during pregnancy? Option A, insulin requirements moderate as the pregnancy progresses. Option B, a decreased need for insulin occurs during the second trimester. Option C, elevations in human chorionic gonadotrophin decrease the need for insulin. Option D, fetal development depends on adequate insulin regulation. The correct answer is option D, fetal development depends on adequate insulin regulation. Question number 415. A pregnant client, age 32, asks the nurse why her doctor has recommended a serum alpha-fetoprotein. The nurse should explain that the doctor has recommended the test. Option A, because it is a state law. Option B, to detect cardiovascular defects. Option C, because of her age. Option D, to detect neurological defects. The correct answer is option D, to detect neurological defects. Question number 416. A pregnant client with a history of alcohol addiction is scheduled for a non-stress test. The non-stress test. Option A determines the lung maturity of the fetus. Option B measures the activity of the fetus. Option C shows the effect of contractions on the fetal heart rate. Option D measures the neurological well-being of the fetus. The correct answer is option B, measures the activity of the fetus. Question number 417. A gravida 3 PART-2 is admitted to the labor unit. Vaginal exam reveals that the client's cervix is 8 centimeters dilated, with complete effacement. The priority nursing diagnosis at this time is option A, alteration in coping related to pain. Option B, potential for injury related to precipitate delivery. Option C, alteration in elimination related to anesthesia. Option D, potential for fluid volume deficit related to NPO status. The correct answer is option A, alteration in coping related to pain. Question number 418. During the assessment of a laboring client, the nurse notes that the FH are loudest in the upper right quadrant. The infant is most likely in which position? Option A, right breech presentation. Option B, right occipital anterior presentation. Option C, left sacral anterior presentation. Option D, left occipital transverse presentation. The correct answer is option A, right breech presentation. Question number 419. While assessing the postpartal client, the nurse notes that the fundus is displaced to the right. Based on this finding, the nurse should option A, ask the client to void. Option B, assess the blood pressure for hypertension. Option C, administer oxytocin. Option D, check for vaginal bleeding. The correct answer is option A, ask the client to void. Question number 420. The nurse is monitoring a client with a history of stillborn infants. The nurse is aware that a non-stress test can be ordered for this client too. Option A, determine lung maturity. Option B, measure the fetal activity. Option C, show the effect of contractions on fetal heart rate. Option D, measure the well-being of the fetus. The correct answer is option B, measure the fetal activity. Question number 421. Which of the following nursing theorists developed a conceptual model based on the belief that all persons should strive to achieve self-care? Option A, Martha Rogers. Option B, Dorothea Oram. Option C, Florence Nightingale. Option D, Sister Callista Roy. The correct answer is option B, Dorothea Oram. Question number 422. Which nursing delivery model is based on a production and efficiency model and stresses a task-orientated approach? Option A, case management. Option B, primary nursing. Option C, differentiated practice. Option D, functional method. The correct answer is option D, functional method. Question number 423. Leonor, 72 years old patient, is being treated with antibiotics for her UTI. After 3 days of taking them, she developed diarrhea with blood stains. What is the most possible reason for this? Option A, antibiotics causes chronic inflammation of the intestine. Option B, an anaphylactic reaction. Option C, antibiotic alters her GI flora which made Clostridium difficile to multiply. Option D, she is not taking the antibiotics with food. The correct answer is option C, antibiotic alters her GI flora which made Clostridium difficile to multiply. Question number 424. 5 moments of hand hygiene include all of the following except option A, before patient contact. Option B, before a clean aseptic procedure. Option C, before body fluid exposure risk. Option D, after patient contact. Option E, after contact with patients surrounding. Option F, none of the above. The correct answer is option F, none of the above. Question number 425. In infection control, what is a pathogen? Option A microorganism that is capable of causing infection, especially in vulnerable individuals, but not normally in healthy ones. Option B, microorganisms that are present on or in a person but not causing them any harm. Option C, indigenous microbiota regularly found at an anatomical site. Option D, antibodies recruited by the immune system to identify and neutralize foreign objects like bacteria and viruses. The correct answer is option A microorganism that is capable of causing infection, especially in vulnerable individuals, but not normally in healthy ones.